Hi, Assalamualaikum warahmatullahi wabarakatuh, and good day to everyone. Welcome back to the class Industrial and Organizational Psychology. In this lecture, we are going to discuss on stress management. So before we begin, let's look at the definitions and the scope of stress. Stress is a feeling of emotional or physical tension, our feelings. So stress can come from any event. Stress can also come from our own thought. These events and thoughts makes us feel frustrated, makes us feel angry, and makes us feel nervous. Stress is basically our own body's reaction, our physiological and biological reactions towards environmental cues, towards environmental stimulus that challenge or demand us to respond. In the short term, stress can be a positive thing. Why? Because stress helps us avoid danger, and stress makes us do or perform things that we're supposed to do. Stress can become a push factor so that we will perform tasks, assignments, or duties or responsibilities. On the other hand, if stress is prolonged, stress has basically been with us for a long time, a long period of times, stress can become very detrimental, especially to our health and to our mental health. And in the context of organization, in the context of workplace, stress can affect individual as well as organizational performance. So in this lecture, we are going to look into 5 subtopics which highly related into stress. First, we just discussed about definitions, part of introduction, and after this, we are going to look into 2 types of stress, and then we are going to discuss symptoms of stress. In the second part, we are going to look into the process of stress, and then we are going to discuss sources or factors that make people feel stressful. And next, we are going to discuss the consequences of stress. What happens if people feel stressed? And in the last part, we're going to look into programs, into interventions that an organization, a company, and institutions can organize to reduce stress under the topic of stress management intervention. Now let's look into type of stress. We nowadays always listens to, hear to, or come across with people who express their stressful feelings, who share their stressful conditions. But bear in mind, this discussion only hover around one type of stress, which is distress. Well, in fact, stress have 2 types, eustress and distress. What is eustress? Eustress is a stress that results in positive energy and improvement in performance and health. So this type of stress is positive and is basically motivational. We as a human being can perform at our optimum levels when our stress have caused optimum arousal. So what is optimum arousal? Some people require some sort of stress, but not too much. So we need to be at our peak performance with appropriate amount of stress. So we cannot have less, we cannot go beyond. If we have less stress, we will not perform at our best. And if we have too much stress, it will become distress and turns into burnout. So we need an optimum levels of stress so that we can perform at our best. So this type of stress is positive and motivational, and it's called as eustress. Like I mentioned, people nowadays discuss openly about their stressful emotions, stressful feelings, stressful experience, and etc. This kind of discussion refers to the distress. Stress that results in negative energy and decreases performance as well as health. So this is basically a negative type of stress, and people who experience this type of stress will feel discomfort. And what happens after that? It will lead to unfavorable outcome, such as problems, deteriorating of health, problem of mental health, and etc. So stress have 2 types, eustress and distress. Okay, still under introduction. So what are the symptoms? What are the signs of stress? How do we know that we are currently experiencing stress? Or how can we know that our friends, our family members are experiencing stress? So now we are going to discuss the symptom of stress. So researchers, clinical psychologists, even health practitioners nowadays have listed out a lot of symptoms, a lot of signs of stress, which can be categorized into 6. Physical pains, sickness, negative thoughts, emotional dysregulation, attention problems, and lastly, sleeping problems. Let's look at one by one. The first symptom of stress we can see is the physical pains. Okay, the physical pain experienced by people who have stress or who experience stress, such as headaches, neck and shoulder pain, back pain, heavy chest, tight muscles, very difficult to move, and feeling tired all the time. So these are the physical pains that people who experience stress always reports. Okay, second, sickness. Okay, sickness. People who experience stress, remember, is emotional and physical tensions. They reported skin rashes. Okay, they reported infections. They experiences illnesses, many sort of illnesses. They have bowel problems, and they also have eating problems. Sometimes they cannot eat, they don't have appetites, they eat too much, or the other way around, they eat too many or binge eating. Okay, I have a friends who experience skin rashes. While I'm doing my masters, okay, I basically at that particular I'm completing my masters. I have my juniors who just started his masters by research. So he just got married and then just got one child, and then he registered or enrolled for masters by research. So I started to notice that he developed skin rashes around his elbows at the first time, but later within the same semesters, within one semester only, the rashes goes to all of his body. In fact, on his face. Okay, he told me that within his body, under his shirts, there are more rashes. Okay, skin disease. And then when he goes to meet doctors give all sorts of medication, including steroids for him to reduce his rashes. But all of those medication could not improve or remedy his condition. End up the whole of his body, including his head, okay, all of his hair fall. Okay, he has problems with the skin rashes, and it's end up that doctors say that possibly because he is stressed. And what happened? He quit his study, and within 2 years his condition improved. At one time he was even admitted to ICUs because the condition was so bad. Okay, so bad, skin rashes due to stress. Okay, next is negative thoughts. People who are stressful, they usually very worries, okay, about their condition, about a lot of things. Sometimes unimaginable or unrealistic worries about a lot of things, and then they usually have guilt. Okay, don't tell me that. Okay, they usually have guilt toward themselves, so guilty feelings. So these are two examples of negative thoughts experienced by people who are stressful. And next, emotional dysregulations. People who are stressful, they can easily getting angry. Okay, sudden burst in emotion, shouting. Okay, they can easily be triggered because of their stressful condition, and they sometimes feel sad and even cry due to their stressful event, a stressful situation. And next is attention problems. Okay, people who are stressful, they have problems to concentrate for a long period of time. Okay, sometimes they can only concentrate for a couple of minutes. They cannot focus on what they do. They cannot focus on what they see or they listen. Okay, they cannot pay attention because of the stressful condition. They cannot sit still. Okay, they are restless. They do not know what to do. There are too many things to do, and end up they do nothing. Okay, and usually their mind are elsewhere because they have problems to concentrate. They have problems to focus on one thing, to pay attention. Their mind are always thinking about other things. Okay, so they have attention problems. And lastly, they also have sleeping problems. Okay, they have insomnia, difficulty to fall asleep. Went to sleep at 11, at 1 a.m., at 2 a.m., they still do not fall asleep. Their mind still working, their mind still thinking. Okay, they have sometimes when they fall asleep, they sleep too much. Okay, usually they sleep for 6 to 8 hours. Then when they are stressed, they sleep for 10 to 12 hours, and sometimes even more. They can even sleep the whole day. Why? Because they are stressful. And sometimes they cannot sleep at all. They went to sleep, but they are unable to fall asleep. And if they fall asleep, they are having nightmares. Okay, they are having bad dreams. So these are the 6 categories of symptoms. Okay, symptoms of people who are having stress: physical pains, sickness, negative thoughts, emotional dysregulations, attention problems, and sleep problems.